So next we're going to talk about our observation machines. In each of our cubicles within the major areas, there is an observation machine attached to the wall. They're generally a little bit smaller than this. We also have 2 transfer monitors within the department. One is kept in green resus and one is kept in blue resus. These are ideally for when patients are on transfers, ITU, CT transfers, that kind of thing, but can be used within the rest of the department if we have any breakages of the other OBS machines. On all of our OBS machines, you can do blood pressure, you can do saturations, and there is also leads available for 3-lead ECG monitoring too. These machines, there's a little clip at the side, a little black clip there, you press that to turn it on. On our smaller machines in the cubicles, there's a little button on the front that says on and off. Press that and it will come on. Press continue. Our oxygen sat probes should always be attached. And it's very simple, put the clip on the patient's finger and it will come up with a reading. We do have oxygen saturation probes for children as well, depending on the size of them. So if you speak to the paediatric nurses, they'll be able to get you the appropriate size sensor for the children. Since COVID started last year, we've been using disposable blood pressure cuffs on all of our patients, whether they are blue or green. We have varying different sizes of blood pressure cuffs within the department. We have our standard size for adults, which is blue, and we have a lighter blue for our smaller adults and darker and a red colour for our larger adults. There is also children's sizes available right down to neonates, so whatever size patient you have, we can get you an appropriate sized cuff. To take them out of the package, there's no other way than just ripping it open. To make sure it fits your patient, you need to have your arrow going down your artery, and then your patient's arm should mean that this part folds around within those 2 blue bits, 2 blue lines there. Pop that on your patient, and then with your green wire here, the end of your blood pressure cuff just pushes in there. To get a blood pressure on these machines, you press your NIBP start and stop, press that and it will run for blood pressure. Your 3-lead monitoring goes in this green circle here, and it will automatically come up with your 3-lead monitoring on there. And there are OBS machines. We do observations on patients as soon as they arrive, ideally in triage or in the assessment areas, and regularly, hourly throughout their stay. As doctors, we may ask you at times if you feel that this is appropriate that we slow these observations down a little bit. If the patient's stable or something, we'll be asking you to write that in the patient's notes. Otherwise, it's policy that we have to keep doing patient's observations every hour. Thank you.